Hey YouTube, how's it going? Today I want to convince you that more treatment isn't always necessarily better, or at least doesn't always lead to better clinical outcomes. Because there are many practitioners out there that may lead you to believe that when you start a course of treatment for musculoskeletal care, post-surgical care, or just general pain and dysfunction, that you'll need at least a minimum of 3 sessions a week for a minimum of 3 months in order to get better, or whatever the case is. But this isn't always the case, and I would argue that this is never the case. Nevertheless, in my most recent Instagram post, I highlight exactly this in a paper that was conducted in 2014, done on people who are suffering from acute to chronic whiplash-associated disorder. So let's read through it together. They took 172 participants with chronic whiplash-associated disorder. 50% of them received 20 sessions of treatment over 12 weeks comprising of a comprehensive exercise program, and the other 50% only received 1 session of treatment comprising of advice and telephone support. So if you read the full text of the paper, they already go over the fact that when it comes to acute whiplash-associated disorder, which is cases of whiplash that have occurred within a couple of days to a couple of weeks from the initial incident, then there's already research that shows that more healthcare sessions or physical therapy sessions does not lead to better clinical outcomes. But this isn't necessarily the case for chronic whiplash-associated disorder, which are symptoms of whiplash that have occurred for 3 months or longer after the initial incident. So they took a fairly decent sample size of 172 participants, with one half of them only receiving 1 physical therapy session comprising of mostly education, advice, and how to manage their symptoms and their condition going forward on their own, compared to the other group which had a whopping 20 sessions over the course of 3 months. Once they performed a follow-up after 14 weeks, 6 months, and 1 year later, there was no statistically significant difference in most of the outcomes. The comprehensive exercise program, comprising of 20 sessions, was not more effective than advice alone for outcomes like pain reduction. Simple advice was equally as effective as the more intense and comprehensive physiotherapy exercise program. But why? Why is this the case? Well, whiplash-associated disorder, first of all, is incredibly complex. The presence of central nociceptive hyperexcitability and post-traumatic stress symptoms may be the reason why the treatments are not demonstrating large improvements in outcomes compared to just advice alone. So this is what was hypothesized by the authors of this paper, but we know that in general, musculoskeletal disorders and pain are also incredibly complex. Pain is an incredibly multifaceted and complex phenomenon that cannot be resolved with exercise alone, but more so taking into account the entire background and history of the patient. Their environmental factors, social factors, economical, physical, and even psychological factors that can be contributing to the condition at any given time. And all of these factors can potentially contribute equally when it comes to the intensity of their pain. When we say the presence of central nociceptive hyperexcitability, it may sound like a lot of big complex words, but it's actually fairly easy to understand. What we mean by central nociception is the brain and the central nervous system's ability to perceive pain. And when we say there's hyperexcitability, this in simple terms basically means an increased sensitivity of the brain's ability or function when it comes to its perception of pain. We know that pain isn't only related to tissue damage and has a lot to do with the complete background and history of the person and what affects their ability to perceive pain according to their beliefs, their expectations, and a multitude of other psychological and environmental factors. And that's why we see the approach of more modern evidence-based practitioners shifting to more of a hands-off, hyper-communicative, patient-centered approach, which involves a whole lot more of advice, guidance, education, and just general ways on how the patient can manage the condition on their own, as opposed to a hands-on approach with lots of manual therapies and complicated exercises that require the guidance of a licensed practitioner. The best way to improve somebody's pain and dysfunction in the long term is to improve their self-efficacy. Self-efficacy is basically their ability to handle or manage their condition on their own. If a patient fully understands their condition from the get-go, fully understands what it means, and fully understands how to manage it through exercise and lifestyle modifications without the necessity of being supervised, then in many cases there is no additional need for stringent follow-ups. The takeaway is that musculoskeletal conditions have been identified as one of the leading causes of disability and chronic pain. So the need to identify effective and affordable strategies to prevent and treat these conditions has been highlighted as an important priority. Obviously, it depends on the patients themselves, how much they can afford, and the availability of healthcare services within their area. If there is a lot of readily available healthcare and physiotherapy services and the patient themselves does not really mind the extra care, then obviously they can go for it and it isn't necessarily harmful. Although I would argue that having more healthcare and physiotherapy sessions may create more of a dependence, but I digress. In many cases, we have to think about the cost to benefit ratio when it comes to recommending additional services for a patient when it comes to treating or managing their condition. And in many cases, most of the therapies that we perform for patients can be taught and self-administered by the patient alone without the necessity for more treatments. And this will lead to the exact same clinical outcomes as long as the patient is adherent with their rehab protocol and understands what needs to be done. Obviously, when there is a lack of supervision, you may get patients that'll get lazy, distracted, or simply does not want to do what needs to be done, and therefore may benefit from the additional supervision and guidance that may come from multiple sessions. There is a need to determine how to deliver simple advice successfully. Education and advice has been shown to be as effective as more costly interventions, yet we need to better understand how to deliver these to patients in the most effective manner. This is an ongoing topic of discussion and much needed research, and requires practitioners to be a lot more empathetic, caring, and avert a lot more time and attention into communication. The paradigm shift necessary for this to take place is going to take a very long time. But hopefully, with the correct guidance and information out there, it will still happen slowly but surely. Thank you for watching. This is Bradley Cato. Please let me know if you have any questions, concerns, comments, or recommendations in the comments below. Subscribe and like for the algorithm and leave me a comment, and I'll see you in the next one. Thank you and peace.